the reason why I'm doing this lecture is because, or this discussion, is to be able to give you a little bit better information about what's going on with your own body, number one. Number two is inevitably you may be waiting a little bit of time, and as I'm sure you're flipping through some of the magazines, which might be a little bit dated, I wanted you to have a little bit of information about how to be able to understand some of the things that I want to discuss with you. If we haven't discussed things before, and this is our first meeting, one of the things I want you to understand is that at the end of the day, I want you to be able to walk out of here with more information than what it was before you walked in here. I think it's important that patients have the ability to be able to have an understanding of their condition in order for you to be able to make appropriate decisions about how it's going to affect you. And I think that many times we'll get back reports from an x-ray or an MRI, and it is gobbledygook. You just wouldn't know it from, a foreign language that you're trying to figure out. And what I will hope to be able to do is to give you a better clarification about some of the words that we use in order to describe the anatomy, and how after that we can be able to introduce what some of the problems that might result from that and why you might be having pain accordingly. Okay? So the first thing that I want to kind of give you an overall gestalt of is let's use a few pictures, because I think for me pictures are worth 1,000 words. It's easy for me to be able to sit here and tell you a whole host of different things and using fancy terms and all this and that, but when you can see it, you can understand it. And I think for most of the patients I know, when we can be able to give you a physical representation, it all of a sudden clicks. And so what I would say is let's take a look at a few different pictures, introduce you to what the body looks like from the outside all the way to the inside, and then give you a reference point to what we're trying to be able to connect in terms of some of the x-ray images that you might have and how that relates to what's going on with your body. So first of which, if you take a look at this picture over here, you can be able to see someone who's facing away from us. Right side's over here, left side's over here. We have a whole host of different musculature that impacts that area and region, and then underneath the musculature, that's where we can be able to see the components of the ribs and the aspect of the spine that exist all the way down to the tailbone. And so if you've ever seen that old show, and I might be dating myself a little bit, like Dragnet, one of the things they talk about is having that person come in and take a look, and then they say, okay, turn to the side, buddy. We're going to take a look at you from this vantage point. And we're going to show you that in a couple different perspectives. But that's what this pictorial representation is someone who's facing in this direction, and we're looking at their spine from the side. So what I want to give you a reference point to is in the x-rays and MRIs, you'll frequently hear a nomenclature of a C2-3 or an L5 or a thoracic 12 or something along those lines. That's going to be the first thing that we're going to explain to you. So you walk out of here and you can say, you know what, I know where this number is and I understand exactly where that is in my body. So the body, in terms of the spine, is broken up into three different areas. It's broken into a cervical spine, it's broken into a thoracic spine, and it's broken into a lumbar spine. And there's the last portion, which is the sacrum, which is the tailbone region, but these two typically are kind of included together. So I know for some of you this is kind of that aspect of going back to high school biology. You're like, oh my gosh, I didn't like it then, but this is important because it's important for you to understand your disease process, all right? We're not talking about insects and we're not talking about components of other animals that we're looking at. This is something that's going to be important for you. So the cervical area and region, as we're kind of showing you here, or if you were to look at it on the model here, and we can get a little cheat sheet because we can be able to see that aspect of the skull, goes from here down to here. That's the element of your neck. Okay, that's the cervical region. There's typically the aspect of 7 bones that are present in that region, but ironically enough, there's 8 nerves that are present in that aspect. We'll talk about that a little bit later. But let me give you a little bit of clarification about what that means. Is when we take a look at an x-ray or we take a look at an MRI, frequently what you'll see is that there's a component that'll say, for instance, C2, and a component that'll say C3. And what I want you to understand is that if you think about that letter and number at those 2 different points, think about it in terms of it being a parentheses. What we're looking at is not only are we looking at the element of that one bone, but we're looking at the element that's present throughout. What's in between it, what's present all the way throughout. So if I was to kind of take a close-up of a model here, which we're going to jump to a different aspect. One of the things that we see is that there's a bone that's present there, there's a disc that's present there, there's another bone that's present there, there's a nerve root that's present there, there's a spinal cord that's present there, and there's a number of ligaments that exist in and around that area in the region. But basically what I want you to be able to understand is that when you look at an x-ray or when you look at an MRI and it has a line that says C1, C2 or L3, L4, it's referring to the cervical spine, thoracic spine, or the lumbar spine, again, either in the neck, the components of the back near and around your ribs, or in the low back when we're referring to the lumbar region. And when it has that 1 or 2, that's giving the frame of what's the one at the top portion and what's the one at the bottom portion. The cervical spine, again, consists of 7 bones that are present. The thoracic spine consists of 12 bones, the same as 12 ribs. And then the lumbar spine consists typically of 5 bones. Now, there are individuals that are unique, where you have an extra bone or you have less of a bone. Doesn't mean that you're going to have pain or there's a problem or anything that needs to necessarily be done. So I don't want you to be concerned if you see your radiograph report that says, oh my gosh, I got 6 bones. Just tell your spouse or your family member, I'm unique, okay? And you should have known that already. So that's the element of kind of the basic overview of what we're looking at. Let's talk a little bit more in depth and detail about what are some of the more individual areas. So when we take a look, one of the things that we see within the areas of the cervical region is there's different types of anatomy than what we'll find in the components of the lumbar spine. In this area and region, the bones are a lot smaller. They're thinner in nature. They're more delicate, if you would. And the structures in there have a whole host of different things that are present. In between the components of the bone, as you'll find in every level, you have the aspect of a nerve root that exists. But in certain parts of the components of the spine and the cervical region, you'll have an element of vasculature or vessels or blood vessels that are present. That makes a big difference in terms of how we deal with some of the treatment options that we might be able to offer to you. Additionally, the other things that you'll see is that there's a connection between the bones, which are different than some of the connections lower down. That connection, particularly in the back portion of the spine, is called a facet, spelled F-A-C-E-T. It's actually French, derives from face, and it's kind of, if you've ever seen or you're a big fan of gemstones or jewelry, it's the same thing that you'll see from a jeweler, where they'll talk about a face of a gemstone or the face of a ruby or something of that nature. And it looks like that, and I'll show you that in a little bit more depth in a minute or so. But that area can have some degree of arthritis that can take place and cause you some degree of pain that's present. Okay, we'll talk about that in depth in a moment or so. Additionally, as you probably already know and have heard of many times, is that there's presence of the disc that exists in between the bone. And that's certainly present in a component of the cervical spine. It's a lot thinner, it's a lot smaller, but it's still present nonetheless. All right? So going on from there, let's talk about the thoracic spine. That's going to be the process that exists in between my 2 fingers. We're going to have mainly the ribs that are there. It serves as a suit of armor, if you would, to kind of protect some of your inner organs, as things like your esophagus, your lungs, your heart, the upper component of your stomach, and some of the other aspects of some of the other organs that exist. Those structures have a different look. Even from this model that you can see, this component of the spinous process, which exists, and I'm going to show you a little bit of depth about that in a minute or so, because I know that there's someone who's raising their eyebrows saying, spinous process, we didn't talk about that yet. I'm going to get to that in a minute. But you can see it juts back more like this. But if you take a look at the thoracic spine, it has more of an angled approach. Why is that important? The reason why it's important is that if you kind of take a look at this in close in depth, it looks almost as if if you've ever seen an armadillo. It almost overlays it. It's like an armor. It's fixed. It's hard. It's structural in that regard. And the reason why that exists is for the protective nature. But for our purposes, if you're having pain in that element, that region, it is a lot less mobile. It's not going to move like you will move with your neck, or it'll move in the aspect of your lower back. So this is going to pose another potential challenge that we need to deal with. In the lumbar region and the sacral region, again, if you remember the lumbar region, it has 5 bones that's present in the back, and down here in the sacrum it's fused. But here it has a more robust, larger vertebral body that exists, and here the bones, instead of them being angled in this type of direction, again, become more prevalent like this. And that's important with some of the things that we're going to be looking at. Again, it has the nerve roots that exist in between the bones. It has the disc that's present, and it also has that facet component that's prevalent. So let's look at that a little bit more in depth and a little bit more detail. So to pick up the model here, one of the things that I want to kind of show you is what exactly we're talking about. So again, when we look at a bone, the bone itself has a number of different processes to it. Here, this component that's right here in the front, or if we were to turn it on the end on, here is what's called the vertebral body itself. This component is the circular process which really deals with most of where your weight is resting. And in between these areas, as you can kind of be able to pick out, are the discs. And that's present in each of the three different areas, the cervical, the thoracic, and the lumbar spine. Okay? It just depends on how sizable it happens to be. If you take a look again from this vantage point, there's a hole, which is probably the most important hole that's present within the component of the body, in my opinion, because this actually is the protective element that houses the spinal cord, which, as you very well know, is that component that comes down from your brain, and basically all your motor and sensory nerve roots come off of it. And so this size of this hole can be variable from person to person. There are some people that are born with a naturally small hole, which actually sets you up to have problems with other things if that hole is encroached upon, or if it's pushed upon, or squeezed upon, or pinched upon in some fashion. Okay? To go on from there, now remember I told you about the spinal process, I told you I was going to get back to it. That's this element, this little component in the back portion of the spine. For the most part, if you were able to run your finger along your back, that's the part of the back that you can be able to feel. And that's what we use in order to be able to guide us in some aspects of when we're trying to feel for certain portions of the spine. Then, on top of that, we have the elements that are called the lamina. It's seldom that you'll hear that reference, but if you've ever had someone or know of someone who's had spine surgery before, you've heard of someone having a laminectomy. And in essence, they've basically done surgery on this portion of the bone to be able to open up that very space that we talked about before. Okay? In addition, and so this is the thing that's a little bit more harder to see, but where my Q-tip resides right here, that's the facet that I talked to you about before, spelled F-A-C-E-T. If you run across a doc that wants to be a little bit more pompous and use some fancy words to get paid more, it's a zygapophyseal joint. But I'd say just facet, okay? That's the element that if you have someone who says, you know what, I can really feel it in the morning when I first wake up, and I can feel it in my back, and I take maybe some ibuprofen or some Motrin and I feel better, that's the area that you get arthritis in. And that's what I wanted to be able to convey to you in that regard. Again, looking at it, we have the disc that sits here, and we have the hole that the nerve that comes from the spinal cord comes out of. That hole, to use a fancy word, is called the foramina. In essence, it's window that allows for this to be able to exit from. And if that hole's contracted, compressed, or something along those lines, then that can cause pain itself too. So that's the overall overview of some of the things that we're looking at in regards to the anatomy that I think will help you be able to understand some of the discussions that we want to have about your x-rays and your MRIs to give you a better reason, a better clarification of why you're having